great slide at the beginning which has all our logos on it, because I think it's important to start by saying North Central London is a true collaboration between the 5 local authorities, the 5 CCGs and all the major NHS provider organisations, so our acute providers, our community health providers and our mental health trusts. And I also should say that although I'm up on the panel, I lead this work with my colleague Kathy Gritzner, who's my CCG's accountable officer. So I don't want to take all the credit nor all the blame. And when I started this with colleagues, I think we thought, why would you do it? Isn't estates the most boring thing to devolve powers on? But that was before we got to understand what you could really do if you sorted out the health and care estate, and also how difficult the system is. So can I have a show of hands if you've ever tried to build a new NHS building? Yeah, so, and I'd like to know how long it took you. Any bids for the longest time? 20 years. Or can anybody top 20 years? No, I think that is probably it. I personally helped, I didn't get my shovel out, helped to build a treatment centre in East London some time ago. By the time we'd finished it, we didn't need half of it because our length of stay had changed so much, we had 2 empty floors. That is a huge waste of public money, of staff resources. We need to be able to do this stuff better, faster, to deliver the care we need for the populations that we serve. And so that's why we're trying to do it. So I could tell you about the complexities of the system, but that would take about 3 years. But it depends on what kind of organisation you are, whether you can keep your capital receipt. Depending on the amount of money you want to spend, the decision-making process may be very, very lengthy, going up through very esteemed colleagues in NHS England, the Department of Health, NHS Improvement and the Treasury. And it may go through those loops several times. That, as other colleagues has mentioned, is not, the system is intended well, but the practicalities of navigating it are incredibly complex. And what that leaves us with is a health and care estate that is not fit for purpose in terms of delivering what we need for our population. So I've got some stats there which are mostly drawn from the Health for London report. And if you apply that to North Central London, we probably have at least £200 million worth of surplus NHS estate, at least. We could do a lot with that money. We could save a lot of revenue running costs, and we could also reinvest that money for new models of care. So what we want to do is deliver better outcomes. So we're interested in what kind of estate will deliver the outcomes we need. And we know in North Central London that if you have a mental health problem, you do less well than if you were living elsewhere. So mental health is one of our top priorities. Cancer is another one of our priorities, along with transformation of urgent care and primary care, because we have too many people with long-term conditions or multiple frailties getting their care in hospital, where we know, through the emergency route, where we know that they could be supported better in a proactive way closer to home. So our estates is very much an enabler to delivering that transformation, which we're doing. If you spot the other logo at the top, through our sustainability and transformation plan. So our devolution powers are very much part of our longer term 5-year plan for our part of the world. We have quite a big financial sustainability gap. I won't get into a competition about whose gap is the biggest, because I'm sure yours are all very sizable, but we think there is an opportunity here. We also have in our part of the world a 67,000 target of new homes by 2025. So lots of people have wanted to live in North Central London for a long time. We have some very big regeneration schemes in Colindale, Brent Cross, to name my own, but in Camden, in Meridian Water, in the Lee Valley. We have a lot of people moving in. We need new healthcare facilities, but we also need to release some of our surplus land to build affordable housing for our own workforce and for people who want to live in London. So releasing land for housing is a really important aspiration for us. In terms of our devolved powers, we do want to be able to prioritise and retain capital receipts. At the moment, you can only do that if you're a foundation trust. And we want to be able to use those to develop our system. We want to accelerate the decision-making on big business cases because they can slow down improvements across the whole system. We want to think differently about value for money so that we can think about which of our key developments would support better outcomes and sustainability across the system. And we want to think about how we can be flexible about the community and primary care estate. So if you've ever seen a beautiful new primary care centre that is empty, it might be because nobody can afford to move in it. It might be because it's not owned locally and there is no control over setting the rent. We have 237 GP practices in North Central London. We have quite a lot of very experienced GPs who are close to retirement. We have a lot of single-handed practices. We have some quality improvements we need to make. If we have better primary and community estate, we will help improve the quality of primary care and our recruitment and retention challenge. So those are what we're looking for. And just, this isn't, you can have a look at this later, but for us, these devolved powers are part of a systematic approach to looking at how we can support the best use of estate across the system, respecting subsidiarity, but taking much more of that one public sector approach where we try to work together to resolve and address issues to produce the best outcomes. But I would say that devolved powers are a massive incentive for the system to come together to make the changes.